Hello guys, I am Sheetal and right now you are watching TargetStudy YouTube channel, your window to education, knowledge and career. First of all, I would like to thank you for your love and support, which has been the main driving force for last couple of years that encourages us to bring more and more videos for you. I hope that this support will continue for many more years. Like many other videos, thousands of you have seen our video on medical professional neurologist and neurosurgeon and appreciated those. But some of you have asked us about the difference between the two. As promised, we are here with an exclusive video comparing the two, clearing your doubt about somewhat similar medical professionals. In this video, which we have obviously titled as Neurologist vs Neurosurgeon, we will try to clear all your doubts by explaining the similarities and more importantly, the difference between the two, as both professionals treat people with conditions and injuries related to the nervous system. Let us first start with the scope of two professionals. Both neurosurgeon and neurologist focuses on the diagnosis and treatment of conditions that affect the brain and nervous system as well as the spinal cord, blood vessels, muscles and nerves. These conditions are treated by physician in the two related specialties, neurology services and neurosurgery. Then what is the difference between the two? A neurologist treats diseases and conditions of the brain and nervous system, but they do not perform surgery. Some of the common conditions they treat include headaches, Alzheimer's diseases, multiple sclerosis, sleep disorders, pain, brain tumors, peripheral nerve disorders, and amyotrophic lateral sclerosis. Some neurologist focuses on a subspecialty like neurophysiology, pediatric neurology, epilepsy, vascular neurology, behavioral neurology, or others. As far as a neurosurgeon is concerned, he or she is a medical doctor who diagnoses and treats conditions of the brain, spine, and nervous system through surgical and non-surgical treatments based on the type of injury or illness. Due to their extensive training in the diagnosis of neurological diseases, neurosurgeons are also often requested by other physicians, emergency room doctors, neurologists, internists, and general practitioners for consultations. Neurosurgeons are trained to treat people with trauma to the brain and spine, aneurysms, blocked arteries, chronic low back pain, birth defects, tumors in the brain and spinal cord, and peripheral nerve issues. Neurosurgeons also perform surgeries for carpal tunnel syndrome, brain and spinal tumor removal surgery, and spinal surgery. They also treat conditions not requiring surgery like Parkinson's disease or low back pain. So in one line, we can say that a neurosurgeon largely depends upon the surgical procedures to treat a patient, whereas a neurologist forte is to treat patient with only medication without involving any kind of surgical requirements. Now let us talk about the difference in the eligibility conditions to become neurologist and neurosurgeon. If you want to become any of the two, you will have to choose your career path well after your 10th class. The very first qualification that you need to acquire towards your goal is 12th class pass in medical stream followed by a 5.5 years MBBS degree. So, there is not much difference in the required eligibility conditions between the two. Once you have completed your MBBS, then there comes the different path that you need to follow depending upon your choice between a neurologist and neurosurgeon. If you want to become a neurosurgeon, then after completion of MBBS degree, you can get direct admission in 6-year course in neurosurgery leading to the MCH degree or secure a position in a 3-year general surgery training program leading to MS degree followed by 3-year neurosurgery course leading to MCH degree. In case you are not able to secure a good rank in the NEET SS exam, you can also undergo neurosurgery training from private hospital with DNB accreditation. So guys, you can adopt any of the three ways to reach to your goal as per your liking and abilities. But if you want to become a neurologist, then after your MBBS degree, you have to do 2 to 3 years MD or DNB course. After attaining the master's degree, candidates have to do DM to specialize in the field of neurology. Now, let us compare the job profile and responsibilities of both the neurosurgeon and neurologist. As far as the job profile or responsibility of both the professional is concerned, Both the professionals perform almost identical work like examining and diagnosis disorders of nervous system, brain, spinal cord and peripheral nerves to treat these conditions. Their job profile includes ordering, performing and interpreting results of diagnostic tests such as MRIs, PET scans and CT scans, assessing and diagnosing patients, prescribing treatments and monitoring the patient's progress, performing basic administrative and business tasks such as keeping records, writing prescriptions and filling out paperwork. But the basic difference in the responsibilities of both the professional is that in addition to the above task, the neurosurgeon has to oversee and coordinate a team of surgeons and nurses to perform the surgeries to remove tumors, relieve chronic pain and treat wounds, vascular disorders and diseases, assessing and diagnosing patients, prescribing treatments and monitoring the patient's progress, meeting with families of patients in surgery and keeping them updated and handling unscheduled emergency surgeries, etc. Now comes the question of career prospects and job opportunities for both the neurosurgeon and neurologist. So, here I would like to ensure you that both the professionals have almost equal job opportunities and good career prospects, as both the professionals complement each other in the field of medicine. There are numerous government and private medical hospitals that provide equal opportunities for both in their departments of neurology. So in this area, both are quite comparable. Now come the obvious question, that is which one of the two, that is neurosurgeon and neurologist, is more financially rewarding. As obvious, the surgeon of any department are slightly overpaid than the general physician. Same is the case in the field of neurology if you consider the financial aspect. Undoubtedly, the neurosurgeon are compensated better than the counterpart neurologist. But it is also a fact that hold on the subject and expertise in the field can put established neurologists at par with the neurosurgeon in few years of time. And I will not shy to say that exceptionally talented neurologists can even surpass neurosurgeons in financial gains. Do not worry, my dear friends. I am not going to conclude without giving answer to the question which cannot be answered by anybody else except yourself. Yes, I know the question you have in your mind, that what should I, means you should become a neurosurgeon or a neurologist. I have already answered this question that anybody including me cannot answer this, as it is you who have to choose between the two, neurosurgeon or neurologist. It all depends upon one's liking, inclination, aspiration, or more importantly, potential. If you are not afraid of oozing out blood, working for unscheduled hours, performing emergency operation at odd time, then you can go for neurosurgeon. And if you think you have the caliber and potential to diagnose and treat neurosurgery problems without using surgical instruments, then you have the option to become a neurologist. Career is yours, so the choice must always be yours. But we are always here with you to help you out make a right choice. That is all from this video. I made an honest effort to cover all the viewpoints with respect to the difference between neurologist and neurosurgeon in it. We will attempt to make such instructive videos in future as well. We hope you like this video. If it is really so, please hit the like button. For regular notification, it would be ideal if you subscribe TargetStudy YouTube channel. We'll be back with some more videos. Till then, stay healthy and safe. Good luck.